Hey guys, welcome. Here is a video to go along with exercise 1. It's the anatomy and physiology revealed, and it will help you to see our body orientation and some of the vocab words for that. So here is our model standing in anatomical position. And we can also then see that they are standing upright, their feet are facing forward, palms are down and facing outward, they're looking straight ahead. If we look at the prone position, that is laying basically face and belly down with the back side up. And then supine is laying with the back side down and the face belly side up. If we then change to our sections, we can see our coronal plane cutting through like the crown of the head. We can see the mid-sagittal plane cutting directly between the eyes down the middle of the body. The oblique plane anywhere on the body cutting at an angle. The sagittal plane is just cutting any up and down, but just not in the middle. And then the transverse plane cutting like a top half and a bottom half. If we want to look at some of our directional terms, we have anterior being like towards the front of the body. We have deep meaning inside, away from the skin. Distal in the arms and legs, meaning away from the midline or the mid trunk of the body towards the distant fingers and toes. We have inferior, meaning downwards. We have lateral, meaning to the side of the midline. We have medial, meaning towards the middle. We have posterior, going towards the back. Proximal on the limbs, meaning towards the trunk or middle of the body. Superficial, meaning towards the surface, towards the skin. And superior, meaning up towards the head region. We can also look at some of the different body regions, like our abdominal cavity being in the middle of the body. The antebrachial being like your forearm. The axillary region being the armpits. The brachial region being the upper arm. The buccal region being the cheeks. Carpal region being on the wrists. The cranial region meaning the head. The cubital region meaning the elbow. Deltoid region meaning like the side top of the shoulders where your deltoid muscles are. The digital region of the foot being the toes. The digital region of the hand being the fingers. Sometimes we see the facial region meaning the face structures. We've got lumbar region meaning the lower back. Mental region meaning the chin area. Occipital region being the back of the head. Oral region meaning the mouth. Orbital meaning like the eye sockets. Palmar meaning the palm. Parietal being like the top parts of the head. The pectoral, where your pectoral muscles are on the chest. Pelvic, where your pelvis is. The popliteal being the back of the knee. The scapular being the back of the shoulders. Thoracic, the mid-chest and mid-back. and the vertebral along your vertebrae. As you can see, there are other options here to look at, but those are the main ones that come out of your lab manual. If we also look at the body cavities, we have the abdominal cavity, like where your stomach is located, the abdominal pelvic region, including your pelvic region, your cranial cavity, where your brain is, the diaphragm area separating your abdominal cavity from your thoracic cavity. Here's highlighting just your pelvic cavity. Here's your thoracic cavity, separated, of course, by that diaphragm. And then, of course, your vertebral canal. If we take a look at the pleura, here is parietal pleura going around the heart. Here is more parietal pleura. Here's your pericardial cavity. Here is your pleural cavity. And here is that visceral layer for the pericardium around the heart, and the visceral layer around the lungs. Here's a quick look at our organ systems. Here's looking at your digestive system. Here's looking at part of the cardiovascular system, your central nervous system, the digestive system, your endocrine system, your integumentary system, here's your respiratory system, your skeletal system, the urinary system, and respectively, there would be the reproductive systems for male and female as well. And as you can see here, there are a lot of items here that you can look through for each and every one of these different systems. And if you click the little info, it will give you information on the structure. All right, so hopefully that's helpful along with the other resources on the D2L for you to take a look at the different things that are in Lab 1. Of course, if you have any questions at any time, please just let me know. Thanks for watching.